In the first months of the coronavirus pandemic, the woeful state of the UK's preparedness was brutally exposed. On the front lines of the effort to deal with the virus, on our hospital wards, doctors and nurses were reduced to using bin bags in place of what should have been proper personal protective equipment. And so began a desperate government attempt to get hold of more PPE, a process which led, according to one civil servant, to an appalling waste of taxpayers' money.
I felt that we were buying at ridiculous prices, not negotiating enough, not trying to get the best deal. It was just very much, let's buy what we can buy, and it doesn't really matter about the price. I was disgusted at the amount of money that these companies were making. It was just ka-ching, ka-ching, ka-ching for them.
Officials had been overwhelmed with the number of bids to supply the equipment, so they'd set up what became known as a VIP lane for offers coming via government ministers, MPs, or senior officials that were thought to be most credible. Ministers say they were not involved in decisions about contracts and that they were just forwarding promising bids to civil servants, and that all PPE offers went through the same checks.
You were seeing all these VIPs getting contracts. All the other companies that I was dealing with didn't get any contracts at all. The VIP lane was obviously the Premiership, and all the rest of the suppliers were in the second division.
The VIP lane led to the approval of contracts worth billions of pounds. Some of the companies involved did have some relevant experience, but others had never made PPE or any kind of safety equipment. Meanwhile, suppliers who'd had decades of experience in the business found that their offers of engagement were being ignored.
We had products on the ground, we had expertise ready to be deployed, we used the government portals, we used the website, we used all of our existing contacts. There would literally be 50 or 60 attempts every day to break through to central government, and we were coming up against a closed door every single time. And I couldn't understand why anyone in charge would choose to ignore the expertise available on tap. So yeah, I was angry, I was frustrated, but I'm not alone in being disappointed because the entire safety industry was not mobilised as the way it should have been.
Doctors also reported that some of the protective equipment procured simply wasn't fit for purpose.
Masks are meant to have a bit on the bridge of the nose that you press down so it tightly fits the shape of your face. Our masks, often they wouldn't have that, so there'd be a gaping hole between your face and the mask. Other times, you try to put a mask on, but the little loops that you hook around your ears would just ping off onto the floor, so this mask would just fall at your feet. I can't emphasise enough how scary it is to be spending a day seeing COVID patients when some of the PPE on the ward is that inadequate.
The government's expenditure on PPE left it with enormous stockpiles, equipment which was never used. These now make up the next chapter in this long story of waste.
We had so much stock, but we were still buying when we knew that we didn't need any more. The problem with having all this extra PPE was that we weren't able to warehouse it, and that it was just getting left at the docks.
The bill for storing the nearly £10 billion worth of excess stock, which existed at the end of the pandemic in 2022, was astronomical, so the decision was taken to dispose of it, mainly by incineration.
We're talking about probably the biggest misspending scandal in the UK of all time, with billions of pounds of public money wasted and literally going up in smoke. At one point, we were seeing 500 lorry loads of unusable or wasted PPE being burnt a month, and that just seems an insane waste of public money.
Government ministers gave evidence about their purchasing decisions to the COVID inquiry earlier this year.
My total focus was to save as many lives as possible, with primarily talking about PPE, but right across the board. We had to get as much in as we could. In some cases, we paid expensive prices for that, but I think that was worth it to save lives. And in the end, on PPE, we over-succeeded, right? We procured more than was needed and had to, I'm sure we'll come to dealing with the oversupply that we had at the end.
We will.
The pandemic was a national emergency in which the UK found itself in a fierce global competition for the tools needed to fight the disease. But years now since the money was spent, there are still questions about whether it was done properly, and there is no doubt that an enormous amount was wasted. Geraint Vincent, ITV News.